Have you ever heard of cholelithiasis? It might sound like a mouthful, but it's a term that refers to a health issue many people encounter. Cholelithiasis, in simpler terms, is the presence of gallstones in our gallbladder. Now, you might be wondering, what exactly is a gallstone? Picture a small, pebble-like substance varying in size. It could be as small as a grain of sand or as large as a golf ball. These gallstones are hard deposits that form in your gallbladder, a small organ located under your liver. You see, the gallbladder's main function is to store bile, a digestive fluid produced by your liver. But sometimes this bile can harden into pieces that we call gallstones. Despite its prevalence, many people might not even know that they have gallstones because they often don't cause any symptoms. But when they do, it's a different story. In this video, we will delve deeper into understanding cholelithiasis. What causes cholelithiasis, you might ask? Well, let's venture into the answers together. A primary cause of cholelithiasis, or gallstones, is high cholesterol. When your liver secretes more cholesterol than your bile can dissolve, the excess cholesterol can form into crystals and then into stones. So, if you're a lover of fatty, high cholesterol foods like bacon and cheese, you might want to reconsider your diet choices. Then we have high bilirubin, a chemical produced when your liver destroys old red blood cells. Certain conditions can cause your liver to produce too much bilirubin. These include liver cirrhosis and certain blood disorders. The excess bilirubin can contribute to gallstone formation. Now let's talk about the concentration of bile in the gallbladder. Your gallbladder needs to empty its bile to maintain a healthy balance. If it doesn't, the bile becomes overly concentrated, which can lead to gallstone formation. It's like when you leave a pot of soup simmering for too long and it reduces down to a thick sludge. Now you might be wondering, can diet and lifestyle influence the development of cholelithiasis? The answer is a resounding yes. A diet high in fat and cholesterol and low in fiber can increase your chances of developing gallstones. Also, a sedentary lifestyle can lead to obesity, which is a significant risk factor for cholelithiasis. So, a healthy diet and regular exercise can go a long way in preventing this condition. Moreover, some factors are beyond our control, such as age, family history, and ethnicity. Women are also more likely to develop gallstones than men. But don't worry, being aware of these risk factors can help you take precautionary measures. In conclusion, cholelithiasis is primarily caused by high cholesterol, high bilirubin, and concentration of bile. Your diet and lifestyle play a significant role too. It's a complex condition with multiple contributing factors, but with the right knowledge, we can take steps to prevent it. Now that we've covered the causes, let's move on to the symptoms. How do you know if you have cholelithiasis? That's a question many of you might be asking yourselves right now. Understanding the symptoms of cholelithiasis can be a great starting point. The most common symptom is pain in the right abdomen. This isn't just any pain. It's severe, sudden, and can last from 1 to 5 hours. It's often referred to as a gallbladder attack, and it's not something you'll easily forget. The pain can be so intense that it can wake you up from a deep sleep. It might also radiate to your back or right shoulder blade, making it tricky to pinpoint the origin of the discomfort. Now let's talk about nausea and vomiting. These are also common symptoms of cholelithiasis. When gallstones block the bile ducts, your gallbladder becomes inflamed, which can lead to feelings of nausea and sometimes even result in vomiting. Another symptom to watch out for is jaundice. Jaundice is a yellowing of the skin and whites of the eyes. It happens when a gallstone blocks the bile duct that leads to the small intestine, causing bile to build up in the liver. This leads to an increase in a substance called bilirubin in the blood, which can turn your skin and eyes yellow. But here's the tricky part. Some people with cholelithiasis may not experience any symptoms at all. This is known as asymptomatic or silent gallstones. These individuals can live their entire lives without knowing they have gallstones, as they cause no problems. However, if a stone shifts position and starts to cause blockages, that's when the symptoms kick in. It's also important to note that these symptoms can be similar to those of other conditions like stomach ulcers, heartburn, or even heart disease. Therefore, if you're experiencing any of these symptoms, it's crucial to seek medical advice to get an accurate diagnosis. Recognizing these symptoms can lead to early detection and treatment. So, if you suspect you might have cholelithiasis, don't hesitate to consult your doctor. Your health is always worth the time and effort. So, what can you do if you have cholelithiasis? Well, there are several treatment options available, and the best one for you depends on your individual circumstances, including the size of your gallstones, the severity of your symptoms, and your overall health. Firstly, let's talk about lifestyle changes. If your gallstones are small and not causing severe symptoms, your doctor might recommend making some adjustments to your diet and exercise routine. This could include reducing your intake of fatty foods, which can trigger gallstone attacks, and increasing your consumption of fiber-rich foods like fruits, vegetables, and whole grains. Regular physical activity can also help keep your gallbladder functioning well. However, these changes alone may not be enough to get rid of gallstones completely, but they can help to prevent new ones from forming and alleviate some symptoms. Next, we have medication. If your gallstones are causing symptoms but aren't large enough to require surgery, your doctor might prescribe medications to dissolve them. These medications, which are made from bile acids, can help to break down the gallstones over time. But keep in mind, this process can take months or even years, and it's not guaranteed to work for everyone. Plus, even if the medication is successful, gallstones can reform if treatment is stopped. Now let's discuss the most definitive treatment, surgery. If your gallstones are large, causing severe symptoms, or if you have had multiple gallstone attacks, your doctor might recommend surgery to remove your gallbladder. This procedure, known as a cholecystectomy, is quite common and is generally safe. And don't worry, you can live perfectly well without a gallbladder. Your liver will still produce bile to aid digestion. There are two main types of cholecystectomy, an open surgery and a laparoscopic surgery. In an open surgery, the surgeon makes a 5 to 7 inch cut in the abdomen to remove the gallbladder. Whereas in a laparoscopic surgery, the surgeon makes several small incisions and uses a tiny video camera and special surgical tools to remove the gallbladder. Most people who undergo a cholecystectomy recover within 1 to 2 weeks and can return to their normal activities. In some cases, a non-surgical procedure known as endoscopic retrograde cholangiopancreatography, or ERCP for short, might be performed to remove gallstones that have migrated into the bile ducts. Remember, each treatment option has its own benefits and risks, and what works best will depend on your individual situation. So, if you suspect you have cholelithiasis, it's crucial that you consult with a healthcare professional. They can provide a proper diagnosis and guide you towards the most effective treatment strategy for your unique needs. Remember, it's important to consult with a healthcare professional if you suspect you have cholelithiasis. Let's summarize what we've learned about cholelithiasis. Cholelithiasis, more commonly known as gallstones, is a condition that occurs when solid particles develop in the gallbladder. Remember, the gallbladder is that small, pear-shaped organ located under the liver, playing a crucial role in digesting fats. When this process goes awry, we end up with gallstones. Causes of cholelithiasis are multifaceted, and they often involve a combination of factors. The most common culprits are excessive cholesterol or bilirubin in the bile, or when your gallbladder doesn't empty correctly. Factors like age, weight, gender, and genetics can also come into play. For instance, being female, overweight, or over 40 years old can increase your risk. Symptoms, on the other hand, can be elusive. Many people with gallstones may not even know they have them. Silent stones, they're often called. But when symptoms do occur, they can be quite severe. Imagine experiencing sudden and rapidly intensifying pain in the upper right portion of your abdomen, or perhaps in the center of your abdomen, just below your breastbone. Other symptoms can include back pain between your shoulder blades, pain in your right shoulder, and nausea or vomiting. When it comes to treatment, the options depend on the severity of your symptoms. If you're not experiencing symptoms, your doctor might recommend a watch and wait approach. But if you're in pain, treatment may involve medication to dissolve the gallstones or surgery to remove the gallbladder. It's also worth noting that lifestyle changes like a healthy diet and regular exercise can help prevent gallstones from forming in the first place. In essence, cholelithiasis is a complex condition with various causes and symptoms. Treatment varies depending on your personal situation and the severity of your condition. But remember, knowledge is power. The more you know about conditions like cholelithiasis, the better equipped you are to make decisions about your health. Understanding cholelithiasis can help you make informed decisions about your health. Thank you for joining us on this journey of knowledge.